SCID, Severe Combined Immune Deficiency. What is SCID? People with this disease are born without an immune system, meaning they cannot fight off bacteria or viruses or other infections. This is caused by genetic mutation. People also know this disease as the boy in the bubble. This disease was discovered by a patient with SCID named David. His brother had this disease but died from it when he was little, so instantly they put David in isolation to keep him from dying. He lived in isolation for 13 years and he died from a failed bone marrow transplant. Who is affected by SCID? Babies are most affected by this disease. Males are more affected than females because this disease is on the X chromosome and boys only have one X chromosome. No culture is affected by this disease because it is genetic. It's nothing about your lifestyle. SCID symptoms. Symptoms include infections that do not get better within 2 months of starting medication, like antibiotics, 8 or more ear infections, more than 1 case of pneumonia or bronchitis, regular thrusts in the mouth or throat, which is a buildup of a bacteria called Candida yeast, diarrhea, infection that affects the lung and liver completely, and family history of immune deficiencies or death from infection in infants. White blood cells are made from stem cells in the bone marrow. Some of the white blood cells go to the thymus gland, which makes them become T cells, which give the cell signals to fight infections. The others stay in the bone marrow and become B cells, which are the antibodies. With SCID, there are mutations in the B cells and T cells. This causes the immune system to not work because there are no antibodies or signals that it needs to start working. XSCID is when the mutated gene is on the X chromosome, which is the most common version of this disease. Another form is where there's an extra gene on the 20th chromosome, which is the rarer version of this disease. Cures of SCID. This disease, there is a cure, which is stem cell transplants. There are other treatments such as antibiotics, antivirals, antifungals, IVIG infusions, and gene therapy. These other treatments are used to wait to get the stem cell transplant from a donor. What causes SCID? It is a genetic mutation where dozens of genes are mutated. It is autosomal recessive or X-linked, meaning both parents need to have a recessive trait of the disease. Males are more likely to get it because they only have one X chromosome, and this disease is on the X chromosome. It is passed down from parents genetically. Daily life of someone with SCID. SCID is normally in babies only. The babies will appear healthy, but their immune system doesn't work, so once they get a small infection or a sickness like a cold, they could die because they don't have an immune system. If it is found soon enough, the baby will be kept in isolation until it can get a stem cell transplant, getting the treatments like antibiotics and antivirals. How many people are affected by SCID? This disease is so rare that there is no record of how many people have this disease. The estimate for the United States is 40 to 100 people only. There are no records of the amount of people with it around the world because it is so rare. Treatment centers for SCID. St. Jude's Children's Hospital is researching and treating SCID. They're using gene therapy, which is one of the treatments for SCID. They do bone marrow transplants and other transplants like stem cell transplants that cure SCID or help with it. Here are my references.